I cannot just tell you how much rewarding I feel as far as doing this medical mission, because we have helped so many indigent patients who have not ever seen any physicians in their whole life, and we were able to make a diagnosis for the first time, diseases that they're not even aware they have.
Itong problema mo na yan, goiter, no?
Hindi na malalim.
It's quite an experience to do this mission. It's something that money can't buy. You know, the gratitude that these people they really appreciate taking care of these people, doing their surgery for nothing. We pay our own fare, we pay our own hotel accommodation, we bring all our supplies, from sutures to gowns, gloves, everything, you name it.
Our organization has been there for 37 years.
I'm Dr. De Guzman. I've been with the medical mission on the Philippine Medical Society of Northern California. And we have started this medical mission for over 24 years now. And we bring our own, we pay for our fare, and we pay for the medicines.
We pick places in the Philippines that are most in need of health services.
Right behind me are people waiting to be registered, which is right behind you. And these are for adult medicine. As you can see, there's a lot of them. They have been here since 7 o'clock this morning and waiting in line until they're being registered. After being registered, they'll fall another line being called in to inside the hospital. These are for dental, waiting to be called in. And on the other side is for pediatrics.
I have been assigned as the medical coordinator of the medical clinics, and this is the area where we mostly treat the indigent patient on their non-surgical needs, and this is where our medical mission usually has been seeing between, especially during the past several years, between 6,000 to 12,000 patients as the outpatient. This is not even including the surgical patient. Part of our medical mission and is also to provide free medicines to all of them. Most of our non-surgical patients in the medical clinics are screened first by our local doctors in the community where we are going to serve. And they are really play the role as our team from the Philippines. And they see to it that also with the addition of a social worker that they screen that really the patients that we're going to see are the most indigent.
So you better check with your OBGYN. Baka you'll need to have a pelvic exam.
And we want to see mostly cases that is not well taken care of in that area that we're going to serve. Chronic cases such as hypertension, diabetes, infection, arthritis.
We're going to give you medicine for blood pressure, okay?
And all other pediatric cases, mostly pulmonary, as well as infectious disease.
The first day, of course, will be screening of patients that have been already screened by the local doctors. Still, we have to make sure that these patients are screened properly and they're okay for surgery.
This minor procedure area is very successful. We're able to do 30 minor procedures, like excisions of lumps and bumps, lipomas, sebaceous cysts. And this is with the help of the local surgeons here. So I'm thankful for them helping us. but we've been averaging between 25 to 30 patients a day. The cases so far that we have done, there's a lot of younger 20-year-old, 16-year-old female with breast mass, a lot of elderly folks that has had tumors for the past 10, 15 years that they haven't taken it out, and these are mostly lipomas, which are benign fatty tumor, and inclusion cysts or sebaceous cysts. And most of the cases here are really major surgery because it's a lot of gallbladder diseases rather than just thyroid, and a lot of cleft lip, cleft palate deformities.
Under major surgery, they were able to attend to more than 100 cases. This consists of thyroidectomy, cholecystectomy, burn, scars repair, and inguinal hernia repair. Under OB/GYN, surgery also consisted of hysterectomy and cyst removal. For the dental, a lot of patients were seen likewise.
This is the optometry department. We brought some eyeglasses, about 4,000 eyeglasses from the United States, from the Lions inside. What we do is we have the patient register. They gave us their form. We have our optometrist check their eyes. After checking their eyes, they give me the paper. Then we look for the grade and look for all the glasses and the glasses that they need. Then we give it to them for free. Everything is for free. If we cannot give them the correct lens, then we give them frames so they could just go to their optometrist, or we give them sunglasses, which will help them.
Now, we make sure that these patients are also taken care of after we leave. And knock on wood, so far we have been very lucky and not having any mortality or fatality during our mission.
And at the end of our medical mission, whatever left in our medicines, we leave it to the local hospital or local clinics where they could continue to provide follow-up care of the patients that we see. Because especially most of our patients who are non-surgical, they need constant follow-up, those with chronic diseases, hypertension, diabetes, and they will run out of medication. So we'll see to it that they are followed up closely by the local physicians and clinics so that there will be a better continuity of care.
By the way, we have always managed to take 10 medical students so that they can experience the kind of medical culture that they will never probably experience in the United States. And also this guides them on how to make a decision of their, on their future medical career.
Our future plans for this medical mission is to go again to the rural areas of the Philippines so that we can serve in all parts of the Philippines where there is no health care.
As I see this organization grow, we are going to hope very much to have new physicians, especially young doctors, who can continue our vision. And that vision is offering through charity in the sense that we can impart through empathy to this population group.
I'd like to request those people who have money and well off, grants and stuff, if they could help us with this mission. We do this every year. We need supplies every year, and of course money. We also the medicines that we have to buy and bring, sometimes we have to purchase it back home in the Philippines, and it costs a lot of money. So again, I would request help from everybody who would be willing to help us in our mission. And also I encourage everybody who would like to join us. all the volunteers that come, once they come over, they like to come again.